Are you overwhelmed caring for an aging loved one? Whether you're an adult child, spouse, partner, friend, or a professional caregiver, then this podcast is for you. Welcome to Your Silver Lining. Each week, we bring you valuable content to help you provide the best care and support possible, along with tips on how to care for yourself. Your Silver Lining hosts will cover topics such as recognizing when a loved one needs help, advocating for them in the emergency room, managing medications, maintaining fluid and nutritional balance, handling acute and chronic diseases, and much more. And now for the disclaimer. Keep in mind the information you are about to hear should not be misconstrued as medical or legal advice. See the full disclaimer below. And now on to the show with your hosts, Stephanie and Paige.
Welcome to today's episode on Your Silver Lining. I'm your host, Paige, and today we're discussing the silent but deadly epidemic, falls in the elderly. With me, of course, is the amazing Stephanie. She is a registered nurse, the owner and founder of Transitions Care Management, and a certified aging in place specialist.
Yeah, thank you for that. And welcome, everybody. We're so excited to have you here today. This will be the first of likely many episodes on falls and fall prevention, as it's such a big topic. So let's dive right in.
Yeah, let's do this. So we're going to be talking firstly about understanding more about falls amongst the elderly population. Is falling a normal part of aging?
That is such a great question. And I can't emphasize enough that falls are not a normal part of aging. When we say normal, then a part of our brain thinks, well, this is acceptable. And we hear this often, oh, mom's falling. It's just because she's 85. Well, it's not because she's 85. It's because other things are going on. So they're actually the leading cause of injury-related deaths in adults over 65.
Okay.
It really is. About 38 million falls occur in older adults in the United States every year, leading to about 32,000 deaths. So it's a very serious issue. And beyond the statistics, the impact on independence, mobility, and overall health is profound. So,
yeah. Now, what are some of the biggest risk factors that contribute to falls in older adults?
Yeah, there are a lot of risk factors. I'll cover a few. Things like medications, sedatives, blood pressure medications. Antidepressants can cause dizziness and imbalance. Alcohol use, even small amounts, can put somebody at a higher fall risk who may already have some imbalance issues. Dehydration and malnutrition. Dehydration we see in most of the people that come into our practice have at least a mild level of dehydration. So for many adults, as we age, we can lose that sensation of thirst. And so if that's a contributing factor, that can definitely increase the fall risk.
And we will be covering that in our fluids episodes.
We will.
Stay tuned for that.
Ooh, that's a good one. That's one of my favorites. So sleep disturbances like insomnia, sleep apnea, and nighttime confusion can increase fall risks when you're not well rested. Vision and hearing loss, social isolation.
Let's go back to the vision and hearing loss for a moment. As far as hearing goes, is it because if you have a hearing problem, an issue there, does it cause an imbalance, like you're unbalanced?
Yeah, so it can. And here's what's interesting, and I'll share actually a real life story about a client. So the hearing loss itself, could it, possibly, if you're not able to hear things in your environment. Now, let's say you're out walking around and you don't hear the bicyclist coming up behind you.
Yeah.
Right. I mean, that could be a contributing factor. Now, there's also things like equilibrium balances that are coming from hearing issues or issues in your ears. And there's also an issue, and I don't recall the name of it now, but it's where the crystals in your ears get out of line, and it can cause extreme dizziness and imbalance. And it can easily be relieved by physical therapists, just simply moving your head around to get the crystals back in the right place. It's
Wild.
super cool, right? Yeah.
Wild.
Now, I had this done on a patient where she had been dizzy for months, and it was really affecting her quality of life. She had many, many falls. They didn't know what to do with her. We got her into a physical therapist, and the therapist moved her head around and got those crystals back in place, and she sat up and started crying. And then I started crying.
Oh, my goodness.
The relief on her face and in her emotion was profound. It was amazing. It was life-changing. And it was just simply because of these crystals in her ears. So I know, right?
Had no idea.
Yeah. Yeah. Cool stuff.
Yeah. You're amazing.
It was a fun one to figure out and to bring her that kind of relief. So the other part is environmental hazards. And I am a certified aging in place specialist, and that is a certification that is given by the National Association of Home Builders, and kind of a fun and cool certification to get. We'll do an episode on that as well. But that it's all about home safety and helping our aging loved ones age in place.
And what are some of the things that you look for?
So clutter, hoarding, loose rugs, poor lighting, pets underfoot, furniture in places that it shouldn't be, furniture that can move. That's another thing. A footstool may not seem like that big of a deal, but if it's always in front of a chair and somebody moves it into a walkway, then it's a big fall hazard. Throw rugs are a nemesis. So many people have throw rugs. And I have to admit, I'm looking down the halls here right now and
At your own throw rugs.
well, I have a dog who's afraid of smooth floors, so I have throw rugs for her, but I understand the danger. I get it. So people I find can be really attached to their throw rugs, and some will have sentimental value, like had a gal, they had gone to Turkey and had these beautiful handmade rugs that they brought back that they had all over the house. So I don't want to take away things that are important to them, but if you can remove throw rugs, that's one of the big ones.
Throw the
throw rugs.
Yeah.
If not, if it's something they're really attached to, sometimes good quality double-sided sticky tape can help with that. And just being more aware of the environment and looking at the overall picture, which we'll talk more about.
Well, my mother-in-law, she has the wrinkly carpets, and she falls all the time on those. And we keep telling her, get the either get new carpet or get that out of there.
Yeah.
She's like, oh, I love this color.
Yeah. Oh, gosh.
Yeah.
Some of the objections that we come up against when it comes to some of these safety hazards are real. This is, we can look at it and say the throw rugs have got to go. That rug that's wearing out, that is wrinkled, has to go. But we have to listen to the reasons why they're holding on to these things and how can we meet them partway and provide a safe environment.
Yeah.
Right? But also hearing them, so that it can be a difficult balance. And,
Yeah.
In this episode and in subsequent ones, we'll talk about having those conversations and, how do you come up with compromise? Because we don't want to come in and just take over their world, but we want them to be safe.
Well, I think sort of the underlying issue there is they're worried about their whole world changing from one thing, like one fall. And is my family going to come in and, get me out of here, downsize me, or take me to a home, sell my house?
Those are such real fears. And again, in an upcoming episode, we're going to talk about that in a lot more detail. But I think what people don't understand sometimes is that allowing somebody to come in and help and make suggestions, like, hey, Mom, maybe we don't have that glass of wine at night anymore. You've had 3 falls in the past few months. Can we switch to something else? But the problem is that it's easy to look at that as they're taking away my independence, right? So think about how you can phrase these things in acceptable ways to where the person you're talking to feels like they're in partnership with the decisions that you're helping them to make. So think about you sitting there right now, listening to us. If I were to tell you, Jane Smith out there, I'm concerned about you and you are at risk for falling and you need to do this and this. Think about how it's going to make you feel when somebody is telling you you have to make changes. You're not going to be, most people aren't going to have a reaction of, oh yeah, you're right. Some do. Yeah, you're right. I'm going to change this. And, what else do you think I can do to keep myself safe? The reaction more often is a bigger one. And it's I'm fine. I am fine. And there's always an excuse for it.
Yeah. And it might seem really, irrational to us or the daughter or, but it really, there's a bigger underlying reason why that excuse was made.
Yeah.
And so hearing that rather than just the words that are coming out with the understanding that there's something bigger underneath here.
Try and put yourself in your loved one's place. I mean, really, truly try and put yourself there. It's easy to say, oh, if I were her, I wouldn't be in this position. Well, she didn't plan on being in this position either, which is something really important to remember.
Yeah.
So keeping those things in mind are really important as you're having these conversations.
Which leads really nicely into the consequences of falls.
Yeah.
And so what happens if an elderly person falls and isn't found for hours? What happens?
Yeah. It happens more often than we think. The ramifications of it can be severe and even deadly. So we want to take this very seriously. They're called long lie falls. When somebody is laying in place for, hours or heaven forbid days. One of the more severe is called rhabdomyolysis. It's also another name for crush injuries. And so when somebody has a car accident, they're crushed for a period of time. Once they're released, everything that has been building up in that area that has been crushed, those cells and proteins from the cells are releasing and dying, and they get gunky, for lack of better words. And when you release the point that was putting pressure on, then those cells start rushing into the bloodstream. And then once they get to the kidneys, they clog them up. And so they can cause kidney failure, they can cause heart failure. It can, without rapid medical intervention and aggressive medical intervention, it can be deadly. So I'll give you an example how that can happen in somebody who is elderly. And sadly, this happened with my grandfather. Is he was living alone and he fell and laid there for several days before anybody found him and was on his arm. And so the arm was pinned and lost blood flow. And once he was found and went to the hospital, once the arm was released, all of those cells went into his body. And so he very, very sadly didn't recover from that.
Wow, I had no idea.
Yeah, it was really awful. Hypothermia and dehydration can happen when somebody has a fall and not bound.
And it can be inside your home. Like it's a matter of circulation and moving around can keep you warmer. And yeah.
Yep, absolutely. Pressure sores and infections. Pressure sores can develop, especially if somebody is already in a state of dehydration, even mild dehydration. It doesn't take long for them to get into a more severe state. And for pressure ulcers to form, if they don't have a good nutritional intake as a baseline, they don't have good protein intake, they don't have as much protein in their body to protect their skin, so breakdown can happen faster. So there's a lot of things that could be against them, right from the start, not just the fall itself. They can experience delirium and psychological trauma, as you can imagine.
Yeah. Which I think also contributes to being concerned about falling again.
And
absolutely. It leads to less mobility. And then the cycle starts.
Yeah, you're 100% right. Yeah. One of my favorites, though, is I do a lot of fall prevention counseling with families, caregivers, the individuals themselves. It's a big part of our practice. And my favorite is I had a gal, and she said it with such conviction. And I adore, amazing woman. I adored her. But with such conviction, well, I just won't fall anymore. That's awesome. Problem solved.
Yeah.
My my job here is done.
Done.
That's it. We're good.
Yeah.
We did stop her falls, by the way, but it did take working together. And so I guess she was right.
Determined. Yeah, it was her own determination.
She did not fall anywhere, but it was done with forming a partnership with her and putting systems into place and safeguards into place and getting, working with her on good fluid balance and nutrition balance and medication compliance. And so it was a team effort. It was not as simple as I just won't fall anymore. But thinking about it now, that's what happened.
You needed her to do that part of it.
Right.
So let's talk about preventing falls.
Yeah.
What are some evidence-based strategies? Like, how do you prevent falls, and what's the research around that?
Yeah, gosh, there is so much good stuff on this. So as I mentioned at the beginning, falls are preventable for the most part. One of the biggest things we can do, there are three things. The medical management is managing medications. Something as simple as not taking your medications in a timely manner. Like you take blood pressure medication twice a day. And so Mary's supposed to take it at 8 in the morning and 8 at night. Well, she forgot to take it in the morning. And so she's like, oh, it's 2 o'clock. I'll just take it now. And then she takes that dose again at 8. Well, she may have more blood pressure medication in her bloodstream than she should have at one time after she takes that 8 p.m. dose, because she still has that first one, really ramped up in there. So that could lower her blood pressure to a level that puts her at an increased fall risk. So managing medication. So we want to do a medication review. If somebody's falling more frequently, we want to review medications with the doctor and the pharmacist and see if, first of all, is compliance an issue. So before we start taking medications away, we want to see, are they taking them appropriately? Because if she's consistently just sleeping in more, right, and taking those medications close together, and we take them one away, she still needs it for her blood pressure.
Yeah.
Right. So, and that may be being adjusted inappropriately. So first we're going to look at compliance. Are they taking the medications appropriately? Once we figure that out, then are there medications that need to be taken away, increased, decreased, or adjusted because of the falls? Are they contributing to it? Hydration and nutrition, this is huge. This is the first thing we look at when we do a new client intake. It is the easiest to adjust, and it can have a profound impact.
Is it one of the more common?
Mm-hmm. It is the most common.
Oh, okay.
Yeah, I think I can confidently say that in our practice anyway, by far, that the fluid and nutrition aspect of it always have a bearing. Even if it's not the absolute contributing factor, in almost every case, it has a bearing on the reason why somebody's falling. So it's fascinating. Bone health monitoring.
And what's that?
So there'll be a DEXA scan. A DEXA scan is a scan that goes over your entire body and determines bone density. And this is another one of those things that is a normal part of aging. You'll hear me say that every once in a while, but not very often. And this is one. And I think once we get into our 30s, our bone density begins to decrease. If I'm wrong on that, somebody let me know. But it does begin to decrease for most people. So we do want to be mindful of that. And there are some great ways to increase bone density. We'll go into that in another episode. But we want to watch that bone health monitoring and see if there's osteoporosis at play. Their vitamin D levels are okay, calcium levels, and we can make some adjustments there.
So put your caps cap on your certified aging in place specialist hat, and talk about home modifications. What can be done there to help reduce those falls?
Yeah, lots of great stuff that can happen there. First of all, you can do a Google search for a certified aging in place specialist in your area. I do recommend seeking out a professional for this, for helping to come up with a good plan for your loved one's home. They will look at things like lighting, to increase lighting in hallways, staircases, bathrooms, make sure the lighting is accessible. In some older homes, you'll have like a light switch that's like many feet away from the room itself. And so making sure that lighting is accessible is an important one. Decluttering and hoarding reduction, that is a big one, and we see it a lot. Again, that's a whole other episode or 2 or 3. Pet awareness. If they have pets, is there training that can happen to keep them from going underfoot? And then assistive devices like installing grab bars, stair lifts, and using mobility aids like walkers, canes, walking sticks. However, I will say on this episode anyway, do not use suction cup grab bars. I am not a fan of them. I don't feel like they are a good option for somebody who is at high risk for falls. I've just seen too many of them fail. There may be other uses for them, but not in the group of people that we care for.
Like for safety.
Yeah.
And so let's talk about some exercise and strength training.
There's some great programs: Tai Chi, yoga, physical therapy. All 3 we've seen fantastic results with. Chair exercises. And now, with YouTube and videos, somebody can tune in and just go to YouTube and type in chair yoga. And phone apps. There's phone apps. There's lots and lots.
There's also your senior center, which I'm a big fan of mine. And
even though she's not a senior, she still goes to a senior center.
They have a low threshold, low age threshold. I think they want to mix some younger people and some older people, which I help with community, and the isolation. But they are awesome. Some of them are really, really fancy. Like
my favorite is when you told me that you were taking belly dancing classes.
So good. And they have billiards and ping pong and art classes.
Yeah. I love that. And there's some great senior centers across the country.
Yeah, they have full gyms. And mine's free.
Yeah. Oh, nice. That's awesome. Yeah, so definitely check out your senior centers. Obviously, big fans here.
Yes.
Gait and balance assessments are really good. Reach out to your primary care provider and see if they can recommend a physical and occupational therapist that can do some assessments for your loved one as well. It could be really, really valuable stuff there.
So what are the social and psychological supports that you can kind of offer here?
Yeah. So encouraging community engagement. Go belly dancing.
Yeah. Go do it.
Get involved with your local senior center. Are there other avenues available to your loved ones? Are there visiting services? Sometimes there'll be volunteer visiting services if somebody has a hard time getting out of their home. But check with your senior center. They're going to be a great wealth of resources for exactly that service. We want to assess for cognitive decline. So if you notice that a loved one is just more forgetful, and we actually just did an episode on how to recognize when your loved one needs help. And so part of that might be, are they becoming more forgetful beyond just normal, I just forgot to pick up milk at the store. We all do that. That's just being human. Are you seeing that more often? Are there dents in the car? Is there mail piled up with unpaid bills? So if you're noticing things like this, it can be hard to have those conversations. And again, finding ways to become a partner in care with your loved one rather than telling them what to do can go a long ways. And cognitive assessment, bringing that up can be a tough one, right? Because that one can be hard as it does speak to independence, right? If they tell me that my memory is bad, that I can't keep track of things, then my independence is going away. They're going to make me move. And it can be a scary one. So it can be presented like, look, I've just noticed some more memory things. It might be nothing. It could be we just need to adjust a medication, but I think we need to look at it and let them know there could be other things that could be contributing to it. I've seen medications that somebody will have side effects, or it's just not a good medication for them, will cause symptoms that impact memory, where it's not dementia. They just needed to change the medication and they were okay.
I think we're seeing that more and more these days as more research and, is coming out about medication side effects.
Yeah. Or that we're paying more attention to it. I think we've known the side effects were there, but, not just writing them off of this is just normal for this medication, but hey, it's great medication. It's like, well, let's see if there's alternatives. If it's causing this impact, is there something we can do differently?
And it's also good to remember to approach these topics with a lot of empathy.
Yeah.
It's important.
How would you like somebody to talk with you about these things?
They might someday. So what are some of the emergency response and monitoring that you can recommend? I know that they've come out with some new cameras recently that have those pictures of not like your loved one walking around the house naked, but a stick figure. And so you could see when somebody's on the ground.
Right. Yeah. What great technology. Yeah. So we used to be reluctant to do cameras in the house. But if somebody is a higher fall risk and the option of them moving is not on the table yet, there are some things that we can look at. So there may be security or camera devices that we can look at, and we'll put some links in the below the podcast as well. Smartwatches, pendants, in-home sensors. We talked about the in-home sensors, routine check-ins. If they have neighbors close by, maybe you could, it takes a village, right? Maybe neighbors can stop and check in. Family members maybe do a daily call at a certain time. So there are a lot of things that we can put in place. The fall detection stuff, there's, I know Philips does or used to be called Philips. They're called, I think it's just Life Alert or Lifeline. They have a fall alert monitor that actually goes outside the home. And so if somebody were to fall on a sidewalk and lose consciousness, then there's a GPS locator. The representative comes on and says, Mrs. Jones, are you okay? If they don't answer, then medics are called and they can locate that person. So there's some great technology out there.
Yeah.
And
AirTags.
AirTags. Yeah.
I mean, that's not for fall detection, but
true.
If somebody wanders a little bit.
Yeah.
We'll talk about that later.
We will. Yeah.
We have a lot of episodes. So what are the biggest takeaways that you would like to kind of reiterate for today's episode?
Yeah. Biggest one is that falls are not a normal part of aging and they are preventable. So I think the biggest thing is don't say, gosh, mom's been falling a lot, but she's been doing that for a while. It's like, that's not normal. You're a fall away from a catastrophic fall. It is important to be aware, to intervene with kindness and empathy. And you've got lots of resources.
Definitely. Well, I would like to thank you for sharing your expertise today, Stephanie. I'm sure people will find this invaluable. And if you have found this episode helpful, please like, follow, subscribe, and share it with somebody who you might think needs to hear this.
We're so glad you were here, and we look forward to seeing you in the next episode. Bye.
Thank you for joining us on this episode of Your Silver Lining. We hope today's discussion was insightful and empowering. Aging isn't just about getting older, it's about embracing the journey and making the most of every stage of life. Through it all, we've got you. If you enjoyed this episode, please like, subscribe, and share it with anyone who might benefit. Your support helps us reach more people. Have a topic you'd love us to cover? Send us a message. Let's continue the conversation. Connect with us on social media or visit our website at yoursilverliningpodcast.com. Join us next time as we keep supporting you and caring for your loved ones. Until then, stay positive, be well, and remember, we are your silver lining.